What advice do you have for people who are not happy with their pulmonary hypertension specialist, and how should they go about finding one that they can work with?
If you're not happy with your specialist, I think vocalizing that. Communication's a group experience. Just because you're feeling that and internalizing it doesn't necessarily mean they are aware, maybe, of what's going on. So I think vocalizing it and saying, something here is not working. And possibly even asking if they have a different clinic in mind that would be a better fit. Um, and I know you had mentioned earlier in this presentation, and I think it's on the PHA's website, a list of different specialists that they themselves can look for if maybe they don't feel comfortable vocalizing that because everyone's not super comfortable with confrontation. But my past experience was I just stopped going, which don't do that. So that's my not advice is don't do that because by the time I saw you and found somebody I really liked and got that referral to you, it was like, "Oh, you haven't done this. Oh my gosh, you're really sick." So don't let it pile up. Don't be avoidant. Get out there and find someone new because that's what I did, and that was not a good thing to do. So
I think that's wonderful advice. And it's the type of advice like coming from somebody who's been through it, I think is just so meaningful because it's very easy for me to, recommend well, speak up and let us know. And but you're right, I think that often, we tend to not want to have a confrontation or feel like there could be confrontation. And I guess from the side of, sort of the specialist or provider, I would say that when we seek out as physicians, this line of work, like our goal is truly to help people. And at the heart of it, if what we're doing isn't necessarily being received in the way we think it is, we should be okay with trying to help our patients find the right provider for them. And if it is a specialist in pulmonary hypertension, we should have, access to be able to give some examples, some advice, some recommendations, because I've had patients who have asked for, I'd like to make sure that everything's being done. Would you have, someone I could seek second opinion from? And my role is absolutely, let's make sure all of your information gets to that person. Let's make sure that they're aligning with my recommendations. Maybe they have something different to offer. And so I do think that it's vocalizing it, as you mentioned, and then realizing that it is about you, like you as the patient. That is what matters here. We're just in a position to hopefully be able to give you good information.